It's been over 2 months since Canada confirmed its first case of coronavirus. The number of cases in this country now tops 11,000. But how bad it could get or how long this could last is, of course, still unclear. The federal government says projections and models will be released soon, but the health minister insists gathering that data is complicated.
Let's just take, for example, what we could anticipate in terms of the volume of deaths in Canada. In order to actually answer that question, we actually have to get a better handle on how many people we anticipate will be infected in Canada based on what we currently see in terms of infection rates. Of course, that's dependent on the number of measures that are taken in various jurisdictions and how stringently they're being applied or listened to by Canadians. And it also depends on the number of Canadians that end up hospitalized and in some cases using intensive care services. And all that depends on whether or not Canadians are able to apply those own measures in their own lives. And so that's why it's very hard to give modeling that's accurate.
In Ontario, Premier Doug Ford said earlier today that the public in his province, quote, deserves to see the models he's seeing and that he will reveal it all tomorrow. How important is it for Canadians to know where this outbreak may be heading? Anne McLellan served as federal health minister during the SARS outbreak. She joins us now from Edmonton. Good to see you, Ms. McLellan.
Nice to see you, Vashi.
A few minutes ago, we spoke with your counterpart in Ontario during the SARS crisis, and he was advocating for the release of those models. So, obviously we understand how much is fluid, how much can be changed and impacted by the behavior that we exhibit right now. But he said, there is value in Canadians knowing what the government knows. Where do you sit on that?
I can understand Canadians' desire to have as much information as possible. Absolutely. That is one of the things we learned in SARS, one of the things we could have done better. But Vashi, I would say it's really important for Canadians to understand that models are not crystal balls. Models are simply projections. And as the Minister of Health just indicated, the quality of that modeling and the quality, therefore, of the projections depends upon the quality of the information, the timeliness of the information, the questions you're asking. And I don't want Canadians to take a projection. Let's say, for example, the Premier Ford releases modeling tomorrow. There's a certain projection around deaths. Depending on the information that's being inputted all the time into those models, that projection could go up or down. Obviously it will. And therefore, I don't want Canadians to fixate on that. I want Canadians to fixate on what they can do to, in fact, influence those projections. And we know what those things are, Vashi. It's staying at home, it's social distancing, it's washing our hands, it's all the things we've heard. We, as citizens, can actually influence the outcomes of those models. And that's what I want people to remember.
Can your concerns that you outlined there be mitigated if the message accompanying the release of that data is very much like you're saying, and that we have, to be fair, heard from every level of government for the past at least 3 weeks?
Yeah, I think obviously the fear, if you like, or even complacency that could be produced by the outcomes from models could be mitigated by, if you like, a warning or a caution around the outcomes and saying, look, this is a snapshot at a given time. And the inputs going into the models, and first of all, what models are being used? There are different models we see around the country. Different questions being asked, different timeliness around information, quality of information, and so on. And everybody needs to be reminded, it is not a crystal ball. It is a projection, and it will change, and it may go up and down. And then you find experts, Vashi, starting to argue about, well, why did you use this model and not that model? And what is the quality of your data in comparison to the quality of someone else's data? And that just becomes distracting and really counterproductive, not only for the people who have to deliver on the front lines, but also for all of us as citizens. And we run the risk of actually becoming more concerned and more confused and maybe less trusting about the information we're being told. So I am not one to suggest that Canadians should not be provided with timely information. Transparency is important in this kind of crisis. But let's always remember the kind of information we're getting and actually how useful it really is.
Yeah, I take your point there. I guess I would point to BC and Alberta, where we have seen some numbers released, some sort of modeling scenarios released that really kind of underline what the hospital capacity might be, what the need might be, for example, for ICU units. And you don't see widespread panic there at all. In fact, they got the information and not much has changed. At least you can't really observe that a lot has changed at this point.
No, that's right. And certainly the modeling in Alberta so far has indicated that our healthcare system is well equipped to deal with that projection. But what happens if those projections change? And all I'm saying, Vashi, is that we need to keep reminding Canadians, not a crystal ball, and the projections will change on the basis of the quality and timeliness of the information.
The other topic that's a big part of the discussion as the premiers and prime minister talk right now, they're on a conference call as we speak, is around supplies, personal protective equipment, medical supplies. We know there is quite a variance in the need and the sort of stockpile in each province. Take us behind the scenes, if you could, a little bit, and how does it get figured out at the federal level? Where it goes, how to acquire it, how much to acquire? What's the process like?
Well, I can only draw upon the experience of SARS, but I presume somewhat similar, although I would presume also a lot more sophisticated than we had in SARS because of, among other things, technology, a higher level of coordination and collaboration between and among provinces and the federal government than I think we had during SARS. But behind the scenes, the federal government will be providing and coordinating and collaborating with provinces, collecting information in terms of what's happening on the front lines, where the pressure points are in relation to PPE, what they're hearing from frontline workers. The provinces will be feeding that information up to the federal government. Federal government will be using its purchasing power around the world. Because as we've seen, this has now become, unfortunately, a highly competitive situation where countries are directly competing against each other for PPE. So the federal government needs to weigh in with all its purchasing power, but it's making sure, and some provinces have gone out and purchased on their own, and obviously there's nothing wrong with that. I'm not suggesting that for a minute. They simply don't have probably the quality of information or purchasing power that the federal government should have. So what your federal government is doing is working closely with the provinces, who are in turn working with their frontline healthcare workers, their chief medical officers. What are the needs? What do we need? What is the time frame? And where can we go into the marketplace, either domestically or around the world, and get that product? And logistically, making sure that those supply chains are not disrupted, that you've got the logistics nailed, so you know if you've ordered something and a contract is signed, that is going to be delivered to a certain place at a certain time, and keeping on top of the logistics. And in this situation, it's hard and it's a moving target, but you absolutely have to nail both the demand, the needs across the country, and then the logistics. Well, finding the supply. First of all, your people in the global marketplace and domestically. Where's the supply? And then you've got to nail the logistics in terms of getting that identified supply to the places of greatest need.
I have just less than a minute left, Ms. McClellan, but I wanted to ask you, because we first touched base with you at the outset of this outbreak, at the outset of the pandemic, when there were, it seemed like, many similarities with SARS. But as time has gone on, things have changed and escalated quite a bit. When you sit back and you sort of observe what is happening right now, how does it compare to what you knew so intimately with SARS?
Well, obviously, this is a much faster moving infectious disease. The geographic reach of this infectious disease is so much greater than SARS. Actually, the geographic reach of SARS was really quite small. Countries in Asia and really then Canada. And even within the country, we were geographically able to contain it largely within the metropolitan area of Toronto. That is not the case with this disease. The epidemiology, if you like, of this disease is completely different, involving the whole world, a whole nation. The only upside, perhaps, is that it's not apparently as lethal as SARS was, so that we will see a death rate, we hope, considerably lower than that with SARS. But at the heart of this, an infectious disease is an infectious disease. And I think the basics of public health and how you control an infectious disease remain the same. You just have to deal with it on a much, much larger scale.
Okay, thanks very much for your time, as always, Ms. McClellan. Appreciate it.
Thank you.
Former federal health minister. Oh, sorry, go ahead. Pardon me.
I was just going to say, please, everyone, be safe and be well.
To you as well and your family. Thanks, Ms. McClellan. That's former federal health minister Anne McClellan. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.